afternoon. Buenas tardes. My name is Dr. Scott McNeil. I'm the President and CEO of Delaware Valley Community Health. On behalf of all of our dedicated workers at all of our locations, I want to welcome you to this special event today. It's a beautiful Friday in North Philadelphia. A little bit about Delaware Valley Community Health. We operate 8 locations. This is our flagship, the Santos Health Center. Our 7 other locations are located all around Philadelphia and the surrounding suburbs as well. Our 9th location will actually be opening up right across the street. We'll be opening up a walk-in center, and we'll continue to address COVID issues with walk-up testing, walk-up vaccination, as well as any other issues that are treated in a non-urgent manner for the community here. I can tell you that we were really delighted when the mayor's office called us and asked us to host today's special event. To be able to showcase our particular health center and also be able to talk a little bit about workers for Delaware Valley Community Health, the things that we've done in the last year in terms of addressing COVID-related issues as well as non-COVID-related issues, trying to keep our communities healthy, trying to keep them out of the emergency rooms, keeping them out of the hospitals. It was really tremendous work that our staff did, and we were proud of them. So, we service approximately 45,000 individuals throughout the areas where our sites are. We've got about 330 employees, and we are continuing to grow. So again, we are really delighted to be able to host today's event. And with that, I want to turn it over to our mayor. Mayor Kenney.
Thank you, Doctor, for hosting us today, and thank you all for joining us for the very first drawing of the Philly Vax Sweepstakes. We're really excited to be here. As many of you know, this initiative will award cash prizes from $1,000 to $50,000 to 36 vaccinated Philadelphians, nearly $400,000 in prizes. Earlier this year, our partners at the University of Pennsylvania conducted the first drawing, and we're excited to share more about the winners of these prizes. And before we do, I want to again acknowledge the milestone we reached earlier in the week. As of Monday, over 70% of Philadelphia adults have received at least 1 dose of the vaccine. This is a target President Biden set for the nation to achieve by July 4th. Obviously, it's not July 4th yet, so we beat that goal. And the last time I looked, I think we were the highest vaccinated big city in America. So, correct me if I'm wrong, I'm sure you will. But 70% plus is phenomenal, considering all the criticism and complaints we received early on. Those hiccups were well overcome, and we moved with warp speed after that. While we would not be satisfied until 100% of Philadelphians are protected from COVID, I'm proud of the health department, other city agencies, and countless partners that got us to this point. Over the last 6 months, the government, healthcare systems, pharmacies, and community-based organizations have been working tirelessly to build a robust vaccination network so the vaccine can be easily accessed in every corner of the city. Availability and access has never been greater, and almost 1.7 million doses have been administered at over 270 sites. While we've made great progress, we still have more work to do to get all Philadelphians vaccinated before we can put the threat of the pandemic fully behind us. Today, we're here to announce the first round of winners of the Philly Vax Sweepstakes and share their stories to help incentivize others to get vaccinated. I thank our partners at the University of Pennsylvania who secured the funding for this opportunity, and the Black Doctors COVID-19 Consortium for their support. I also want to acknowledge our Philly Counts team that is canvassing in this and other neighborhoods to have one-on-one conversations with residents about the vaccine. Before I turn it over to Dr. Bedigal, I want to remind you that it's not too late to enter for your chance to win the Philly Vax Sweepstakes. Our next drawing will take place on July 6th. Any adult over the age of 18 who has received at least 1 dose before the drawing will be eligible to win. Get vaccinated and good luck. And now Dr. Bedigal.
So thank you, Mayor. And thanks to Dr. McNeil and to all of his staff for all the work they've done, and to everyone here today. It's really good to be here after 16 hard months and to have good news to share. As of yesterday, more than 880,000 Philadelphians have gotten at least 1 dose, and more than 700,000 are fully vaccinated. These are staggering numbers, and when we first thought about this, we didn't imagine that we could achieve this in 6 months. I couldn't be more proud and more thankful of everyone, including the staff here at Maria de los Santos, that's been giving out vaccine. And that's on top of the hard work that they were already doing every day. But this is when things get harder. The health department is changing our plan from big mass vaccine clinics to slow, deep work to reach every Philadelphian. We're focusing on the community, on small clinics that are accessible, that are easy to get to both geographically and in terms of hours. Partners like Philly Counts have been going door to door to talk to folks one-on-one about why and how they should get vaccinated. And they were right here in this neighborhood yesterday, and we'll be back again next week. So thanks to Stephanie, where is Stephanie? And her whole team. It's important that we do this work now because we know that these vaccines can save lives. You've probably heard about the Delta variant, which has swept through England and stopped them from reopening. Earlier this week, it was determined that 20% of all cases in the US are now the Delta variant, so it's spreading in this country as well. In St. Louis, Missouri, hospitals are already starting to worry about being overrun by people hospitalized from the Delta variant. And the most worrisome news is that this variant seems to hit the young people harder, and that's our lowest vaccinated rate. So we're lucky. The good news is that being fully vaccinated does seem to be protective against Delta, which is why it's so important that we reach every Philadelphian with this vaccine. And that people who've waited to get their second dose don't wait any longer and go ahead and get that dose. By doing that, we can prevent another outbreak, another surge. We can keep more people out of the hospital, and we can keep enjoying the things that make us happy. And if you've been out on the streets of Philadelphia in the last week or two, you know exactly what I mean. So if you haven't been vaccinated, get your shot. There are folks here who can do that for you. If you've only gotten one dose, make sure you get your second. And if it's been more than 6 weeks and you missed your appointment, go get it anyway. No one's going to judge you for that. There are lots of places that will give you your second dose. And we have them on our website. You can go to your local pharmacy, any of our partners. You can find the closest place to get vaccinated at philly.gov/vaccine. And of course, there's places like Maria de los Santos right here that can give you your shot. It's free, it's easy, you don't need an ID, and you can protect yourself and your loved ones. So now we move on to the exciting, happy part of today's program. And for that, I'd like to introduce Dr. Angela Duckworth from the University of Pennsylvania's Behavior Change for Good initiative to announce our big winner. Thank you very much.
Thank you, Mayor Kenney and Dr. Bettigol, for the incredibly important work you've done recently, but really for the entire pandemic, resulting in the vaccination of 70% of Philadelphians. And thank you especially for your partnership on this initiative. I am just thrilled to be celebrating the first winners of the Philly Vax Sweepstakes. This is a giveaway created to reward Philadelphians for protecting themselves and their community from the coronavirus simply by getting their vaccine shot. I'm here representing a team that created this sweepstakes. Our team hails from the University of Pennsylvania, where I'm a professor, and also the Black Doctors COVID Consortium. We're here because 12 residents of Philadelphia were selected this week to win cash prizes if they were vaccinated, and half of those Philadelphians were from the 19126 zip code. Not all winners have been reached yet, so do be sure that you're checking your email and your voicemail or your mailbox for an overnight envelope with a notification letter, and check your other forms of communication as well. I want to emphasize that an important feature of the sweepstakes is that it is geographically concentrated. So while all Philadelphians are eligible to win throughout the entire sweepstakes, in each of our 3 drawings, half of the prizes go to residents of one randomly selected lucky zip code, a priority zip code picked from the 20 communities with the lowest vaccination rates in Philadelphia as of late May. The priority zip code for the next drawing, which will take place on July 6th, is 19133, which is why we are gathered here in 19133 today. So I'll say that again. Half of the next 12 winners will be from this exact community. So if you live in 19133, you have nearly 60 times the chances of other Philadelphians of winning a large cash prize if you get your first vaccine before July 6th. Today, we're especially excited to celebrate that first round of 12 vaccinated prize winners in our sweepstakes. We have two $50,000 winners from Monday's drawing. One of those winners is with us to accept his prize, Mr. Daniel Silva, who you'll hear from in a moment. But before I let Mr. Silva take the mic, I do want to briefly tell you about our second $50,000 prize winner. He's asked to remain unnamed, but he did allow me to share that he is delighted that he is a father and a grandfather. He identifies as a black mechanic from West Philadelphia, and he is very, very grateful. I am so tremendously happy, really, for all of our winners, and I want to remind you that every Philadelphian is eligible to end up in their shoes with a large cash prize from our generous donors, so long as they've had their vaccine before the drawing. Now, I just want to say before I pass the mic to Mr. Silva that if you're selected to win, and unfortunately you have not gotten your vaccination, then you don't win the prize. And this is what behavioral scientists call a regret lottery. And nobody likes to regret. So avoid regret and protect yourself and your family by getting the vaccine shot as soon as possible. So I'll pass the microphone now to Mr. Silva, and I'll let him tell you what it's like to win this prize and what being vaccinated means to him. Oh gosh, I forgot the list.
Thanks, everybody.
Okay, wait, first I have to do this. Yeah. You hold one end and I hold the other. Do we get our photo taken?
Mr. Silva. Thank you.
You're welcome.
Enough? No smiling? All right. Here you go.
Thank you very much. We'll hold that for you. Please.
Okay. First and foremost, I want to say thank you to Mayor Kenney, the University of Pennsylvania, and the Black Doctors COVID-19 Consortium for this opportunity. I'm thrilled to be standing here today and to receive this prize. My name is Daniel Silva, and I live in the Oak Lane neighborhood of Philadelphia with my partner. Although I'm a native New Yorker, I have grown to love Philadelphia since I moved here 7 years ago. I was initially hesitant to get the vaccine and even backed out of my first appointment. My doctor and partner encouraged me to set up a second appointment, so I decided to just do it. I went down to Center City, got my first and second shots. I got my shots because my health is a priority to me, and it's the right thing to do. I believe by doing the right thing, good will keep on coming. And look at where I am now. When I first received the email that I had won $50,000, I couldn't hardly believe it. I kept reading the email over and over and over and over again. I'm so grateful to have won, but I know that my health is not a game. I'm on a limited income with my disability, so this prize alleviates my worries about what I'm going to do tomorrow, or if I have enough for a certain expense. My parents died when I was 6, and since that point, I've worked hard to climb the ladder and not to slide down it. I know this money will help me take the next steps towards that stability. I believe everyone needs to get the vaccine because it benefits your health and helps others. If everyone gets together and does the right thing, the world will probably be a much better place. Thank you again, and to everyone who made this possible.
Thank you, Daniel. Those are amazing words and an amazing story. And I'm Julia DeJoseph. I'm a doctor here at Maria de los Santos and the chief medical officer for our organization, which is called Delaware Valley Community Health. I work with Dr. McNeil. And on behalf of all of DVCH, we want to thank all of you for coming, for hearing the stories of people in our community, people who primary care providers are very proud to call patients. I am not Daniel's primary care provider, but I imagine his primary care provider is incredibly happy and proud of him. And I know with every patient who is protected, we in the medical industry and in primary care especially sleep just slightly better. So congratulations to Daniel, and thank you all for coming. Thanks to the mayor's office, and thanks for Penn for this support. As many people have spoken before, we want to break down barriers or resistance to vaccine. We want to reduce vaccine hesitancy. I think it is incredibly important to ask questions of your primary care provider or of trusted providers when you are not sure about what you want to do for your health. I'm always happy to answer questions. My team is always happy to answer questions, and I think that's the smartest thing you can do, is making these decisions. And I've found that when people ask questions, when they're honest and open, they allow me the opportunity and my team the opportunity to share information that helps them make a decision. Often, I'm happy to say the decision to get the vaccine so that they can sleep better at night, knowing that both they and their families are protected. Many of the federally qualified health centers, like Maria de los Santos and our other 8 sites, have vaccine available. We here at Maria de los Santos accept walk-in patients for all 3 vaccines on the market. We do walk-in for Johnson & Johnson. We do walk-in for Pfizer, which is 12 and older. And we actually have scheduled appointments for Moderna, although we often have available vaccine that allows for walk-ins. We're open Monday through Friday, and vaccine clinic runs from 8 in the morning until 3 in the afternoon. So I encourage you to come to visit us. Come get the vaccine. If you are one of those people in the community who have questions and aren't sure who to ask, please come meet us, come meet our providers. We are happy to spend the time to answer the questions so that you have the information that you need to feel comfortable in making this decision for your health. I also want to thank my amazing team. As Scott said, we have about 330 employees. Every single one of them has been integral in getting vaccine into our community. We are very busy in primary care, as our patients will tell you, and this was a priority, and so our team really had to work together. We had at least a third of the organization actively involved in the 4 live vaccine clinics that we've run since January. I want to thank our patients for their trust in us, and our patients have been advocates in spreading the word in the community. And so I'm just really excited at that opportunity. So thank you to the amazing team here. I hope for those who are still wondering about vaccine, you come, you meet my amazing team so they can convince you of how awesome they are and help you make the decision to feel comfortable getting the vaccine. Thank you, everybody, and I think we will open it for questions now.
All these smart people here, you gotta ask me questions. Wonderful. Yeah.
So since the announcement came out, did you see an uptick in
We're gonna be able to determine that between this time and the next drawing in the next winter, and we'll be able to really quantify. And maybe the.
Yeah, we're running the statistics, so give us a little time, but we're also hoping to have a better estimate after the next drawing.
Okay, thanks.
And Dr. Silva, do you happen to live in 19126 by any chance? The zip code?
Then, oh my God, I forgot this. One nine. Oh no, it's 191. Yeah, 191. That was the first one they did.
Daniel, could you come?
Actually, no, 191. Yes.
I had 2 questions for you. First of all, you explained that you were a little hesitant at the beginning. What was it that convinced you ultimately to get the vaccine?
My doctor.
What did they say?
Because I was basically afraid to actually just take it, only because of my personal issues that I have. But I just decided to have him talk to me, calm me down, and don't worry, nothing's gonna happen, just take it. And I finally did it. I was good, I was fine, I had no problems, no issues.
And is there any, how are you going to spend the money? Is there anything that you're going to buy that you haven't been able to buy before?
I'm going on a trip. Oh yeah, we're going to Las Vegas, not to gamble, but we're going to Las Vegas probably for like 2 weeks. And save the rest.
How did you hear about the sweepstakes?
Actually, it was an email. It was online on my phone. and I already took my shots. And actually, speaking of that, I turned to my partner one night and I said, wouldn't it be something if I won $50,000? And he was like, yeah, we'll be out. Let's see what happens.
Daniel, now that you have the vaccine, what would you say to people that are still hesitant taking the vaccine?
Just take it. I mean, like I said, it's your health. And I know, you get, like me, I won a prize out of it, but still, it's basically your health. I mean, you can either do it, I suggest you do it, and the world will be a better place. Everyone getting vaccinated. Because to have people vaccinated, then you have the other half that's not, we're always going to be stuck in the same situation. Got to give everybody just 100%.
What's it been like to work with the city and like get through this process? And do you know when you'll actually receive the funds and that sort of thing?
Yeah, they said it was mailed yesterday. So hopefully when I get home, it'll be in my mailbox. But I'm sure that I'm not. But
So I don't know if this is for Dr. Bettable or Dr. Duckworth, but was anyone, did you contact anyone and found out that they weren't vaccinated in this round?
Don't know. We haven't actually.
thank you.
You want me to come all the way up to the microphone to say I don't know, but that's in part because we're still notifying winners, and so we will definitely announce that at the next press conference. But I think the third party that is contracted to do all of that is like in the middle of notifying new winners. Yeah, but we will announce that at the next one.
Do you know how many they still have left to?
I don't know, but I do know that it's that they have not contacted everyone. So we wanted to have the press conference as soon as possible, but it's in process. Yeah. Hopefully this week.
So people can still respond? I thought they only had 48 hours.
Well, we're being actually as entrepreneurial as we can because we also realize that, how many of us have gotten a phone call from someone whose ID you don't recognize, or an email from an address you don't immediately recognize. So we're trying to figure out whether we need to go find people in person and so forth, because we don't want anyone to not get their prize simply because we couldn't get in touch with them. So that's why I'm sorry there's a little bit of uncertainty. Like the third party is still trying to do all of that. In terms of entering, here's the funny thing about this sweepstakes. You don't have to do anything to enter because working with the city, we just pick you and you don't have to fill out any forms and so forth. The only thing you have to have done before the drawing is have gotten your vaccine shot and be able to show some evidence of that. So it's an unusual sweepstakes in that sense.
What's the legal, who runs it and who did you figure all that out?
So lots of lawyers were involved. It really is a true partnership. All the organizations that were named here, and University of Pennsylvania is handling a lot of the administration, but we had to get a third party. They're actually vendors who administer sweepstakes, and so just to be in alignment with all the laws, of which there were many, we used a partner. Okay, I'm pretty sure you don't want to talk to me, so I'm just going to
ask a question. You mentioned the Delta variant. Is there a concern that people who are still not vaccinated, but there might be a second wave of coronavirus here in Philadelphia? What's the big concern?
So questions about Delta virus and whether we're concerned that unvaccinated people could experience another wave. We are concerned about Delta. We can anticipate, based on the numbers from the UK and what we're seeing in other places in the US, that by mid to late July, the majority, if not 90% of cases in Philly will be Delta variant. And the Delta variant is more contagious and appears to affect more young people and to cause more hospitalizations. It is prevented by being fully vaccinated. So we're doing everything we can to get as many people vaccinated as possible, really focusing in on the younger adults who think they're invincible. I have several in my family. They need to get their shots. And if they've gotten one and have put off that second one, they're afraid of the side effects, whatever it is, they have to get that second one. But if we do that, we can prevent a wave of Delta, like what's being seen right now in Missouri, in Philadelphia. If we don't do that, we could see our unvaccinated people ending up in the hospital, and we're really trying to avoid that. So we have this great weapon against Delta. We have effective vaccine. We just need to use it.
Are there any efforts to get who's not vaccinated vaccinated? You mentioned a couple throughout.
Oh, yeah.
Like what really needs to get done to fill that gap?
So part of what we're doing is little clinics in community, thinking about extended hours, thinking about weekends, partnering with everyone we can partner with. This is not just a health department effort. This is everybody. And then we are using census tract maps of vaccinations to show our partners where the lower vax neighborhoods are, so that can help direct their efforts. It helps direct our efforts. Incentives. I mean, that's that's one of the reasons we're so excited about this program, and other kinds of incentives. Sports tickets, T-shirts, coffee, whatever we can come up with.
What are you doing specifically to reach young adults who are not do not have as good of a range as others, especially given the fact that they were told early on that they weren't as vulnerable, that there was their parents and their grandparents, and hey, wait your turn because you're not that vulnerable. How do you now reach them and say, yeah, you are vulnerable?
Right, and so a piece of this is what you all are doing for us at events like this, and we've done a whole bunch of events trying to reach people through the media. Because getting that message out, yes, we know that you are safer than your grandmother, but that doesn't mean you're safe. And with Delta coming, you really need to pay attention now. And then a lot of this is being out at community events, being out where people can see us. The work Philly Counts is doing, going door to door, really trying to reach people.